Hi, I'm Sierra and I run Eugene's Speech Language Therapy. This week I want to talk to you about memory. So memory becomes a problem when we age and there's a natural atrophy of the brain after a stroke or disease, or especially after a head injury of some sort. That's when the memory can really become a problem. This is an issue in all aspects of life. So some people don't know why speech therapists work with memory and cognition. Well, if you can't remember a certain fact or a name or something someone told you, how can you converse with that person? How can you participate and communicate? So you have to have all of those things to be able to communicate effectively. If someone has a memory deficit and they're living in the home, let's say, that can be really troublesome if, for instance, they go to cook something and leave the stove on and then cause a fire, or they leave the door open overnight without realizing it. Things like that can be really dangerous. So when you see a speech therapist for your memory, we are going to assess you with a standardized test that's going to give us a really good idea of how you're doing in different parts of memory, because memory is not just one thing. There are a lot of different kinds of memory, and we can pin down where you're struggling. From there, there are two avenues you can go down. One is compensatory. This is where you learn strategies to compensate for your memory deficit. Some things that I use in therapy are visual aids. This can be a calendar, an actual memory book that you open up and it lists things that are important to you. Some people, these are really beneficial and have a lot of information. For other people, maybe someone who has dementia, the memory book is very simple with pictures and keywords. I also teach people to use alarms. So if you have a smartphone, it's really great to use that calendar, use the alarms to alert you, to remind you of certain things. I teach people to be as consistent as possible when it comes to trying to remember certain things. So if you're going to have keys, keep your keys in one spot and only ever put them in that one spot. Lists are great. So writing things down, that's a strategy that I use myself. I make a lot of lists. You can have a daily list where you have shower, brush your teeth, eat breakfast, do some chores, check your calendar, take your medication, where you have a daily checklist and you make sure you do all of those things. To people who are a little bit higher level, higher functioning, will have a list, a to-do list that changes daily. Go to the store, pick so-and-so up, that you can just check. There are even apps that help you to do this these days. The other type of memory therapy is restorative therapy. Now, before I get into that, I just want to say that there is no one thing that's going to cure a memory problem. There's a little bit of controversy in terms of working on things like memory. However, I do find that a global, comprehensive approach can help. So what that means is, I'm not just making you do these memory exercises and that's it. We're compensating, we're doing restorative exercises, which I'll teach you next. And we're also eating well, staying fit, being active and social, and having responsibilities, checking on your prescriptions to make sure they're not affecting you negatively in any way. So restorative memory therapy is actually working on memory exercises to work those parts of your brain. So if we're working on immediate auditory memory, that would be hearing something and then remembering it right away. So repeat these back to me: 52, 38, 72. And you have to repeat that. There's short-term memory, where you wait. There's a little delay before you have to recall it again. And there's narrative and answering questions about what you read or heard. You can work on auditory or visual memory. working with a speech therapist can give someone the opportunity to gain some of their memory back. Thank you very much, and watch out for my video next week.